There's Mr. Grumpy Face. Okay, are we good to go then, Annette?
Annette, I've got Brian and Shelley in the office with me.
Okay, now you're good to go.
Okay, good morning, everyone. This is the Personnel and Human Services Committee of the Berrien County Board of Commissioners. Today is June 3rd. This is our not almost regular meeting, but we've got a packed agenda for us to consider today. So we'll start out with introductions. And joining us from different locations at the administration building are Shelley Jasper, head of HR, Brian Doucette, county administrator, Annette Christie, managing the technology for us. Joining us from the health department or somewhere is Nikki Britton. And then also with Brian and Shelley is Brian Bailey, and he'll talk about a parks resolution. So let's start out with a roll call. Shelley, if you could do the roll call for us, please.
Certainly. Commissioner Harrison,
Present via Zoom from Lincoln Township.
Commissioner Majerick,
Present via Zoom, Niles City.
Commissioner Bell.
Present via Zoom from the city of St. Joseph.
Mr. Chair, you have 3 present.
Okay, so we do have a quorum. So we'll move to our agenda. First item of business is approval of our minutes from May 27th. Shelley had sent those out to us. Commissioners, any comments or suggestions for changes? If not, could I have a motion?
I'll make a motion that we pass those minutes.
And I second that motion.
Okay, we've got a motion and a second to accept the minutes as presented. Shelley, if you please call the roll.
Certainly. Commissioner Majerick,
Yes.
Commissioner Bell,
Yes.
Commissioner Harrison.
Yes.
Mr. Chair, you have 3 yeas.
Okay, so the minutes stand approved. Next, we'll go to several resolutions we have to consider this morning. The first is a resolution from the Health Department ending in 6237. I think, Nikki, you're going to cover that for us.
Yes, thank you. So this is a,
You're real faint, Nikki, if you
oops,
could.
is this better? Can you hear me now?
Not
That's
really.
still very quiet. I don't know. Let's see. I think the microphones on our computers don't want to work anymore. Can you hear me yet?
We can hear you. It's just if you speak up a little
Okay.
bit, it'll be fine.
I'll try to talk real loud.
There, that's good.
Okay, so Resolution 237, this is for entering into a contract relationship with United Way of Southwest Michigan for a grant project. There was some grant funding that was approved last month for the health department to accept funding from the Michigan Association of Local Public Health, or MALF. They received funding from the Michigan Health Endowment Fund. And part of the stipulations of the grant is that at least 80% of the funding to the local health department needs to go to a community partner. The main objectives of this grant project are to increase vaccination rates and to do some really deep community canvassing and information sharing, trust building with some targeted communities that have lower vaccination coverage. So the United Way is serving as our partner on this project. So we are going to be funneling $40,000 of the $46,000 grant that we've accepted. $40,000 is going to United Way for those efforts. United Way will be using that money to fund different partners in those areas, provide incentives for some, vaccine champions or ambassadors or people who are knowledgeable about the vaccine, and endeavor to have deep influence within their social sphere of influence to really try to make sure we have accurate information, accurate messages framed in a way that also makes sense to that community, to that demographic.
So you'll be riding herd on whatever they put out into the media and to the community for encouraging people to get the vaccine.
Yeah, we'll definitely be working together jointly to craft those messages, but the organization and the mobilization of community members to serve in that role is going to be a key piece that United Way will play.
Okay, commissioners, any questions of Nikki?
No, everything seems to be clear. I read the resolution, and I really think this will be a good thing for our community.
Okay, would you be interested in making a motion then to approve the resolution with the United Way contract?
Yes, I move that we approve this resolution.
I second.
Okay, any further discussion? Got a motion duly seconded. Shelley, would you please call the roll?
Go ahead.
Mr. Chair, we don't need motions on individual resolutions. We can do one like consensus at the end of all the resolutions to move those forward to the full board.
That is a disappointment. I just wanted to get everybody's names in the minutes. So, okay, then if there's no further discussion, we'll move on to our second resolution. This one's numbered 6241. And it creates a HIV, AIDS, and STD community health worker position. Nikki, you got the floor.
Yes, so as you may be aware, we do have some HIV prevention and case management services at the health department that is funded through some funding from the state. It's federal pass-through dollars that come to us. We have been really pegged by the state to expand our program as we have additional need, and through the performance of our current staff in this program has been going really well. They really would like us to take on additional. So we have been awarded an additional $50,000. This was accepted in a May resolution of the latest amendment to our comprehensive agreement. With that funding, and to meet the obligations associated with that funding, we do need to hire another community health worker. We have one community health worker who's devoted to the HIV program. We need a second one to be able to meet the needs and the requirements with this funding. So we wish to, with this new funding, create one FTE position. It's a grade 7 in the union.
So this position is funded by grant money, and is there any investment of county resources or health department resources in for it?
There will be a little bit, because this funding is not sufficient to cover all of the indirect costs associated with the position. That is fairly standard with our programs from Michigan Department of Health and Human Services, that there is a little bit of indirect that's not necessarily included in the grant.
And then when you look at our HIV AIDS incidents in Berrien County, are we pretty consistent with the rest of the state of Michigan, depending on population?
Demographic wise, yes, but based on our demographics and some of the risk factors, we are in the higher range of prevalence of HIV in Berrien County.
Okay. Commissioners, any questions?
Okay.
Okay, then we're set to go to our next, again, a health department resolution. This is in numbered 6242, create a community resource navigator position.
Yes, so we have had in our staff complement for many years a medical social worker. And the person who had been filling that position for a number of years retired late in 2020. And as we do when we have all vacancies, we seek to evaluate the position. Is there any needed change to the job description or the requirements or the duties? And we've gone through that evaluation and really wish to replace that medical social worker classification with a community resource navigator. This is a position and a person that maybe doesn't have as deep and is not necessarily a licensed social worker, but still has the skills and the ability to work with community members to definitely navigate things like health insurance, like our medical social worker did do, but also to really work with a lot of the referrals that are happening in the health department. We have a lot of people that we're able to identify needs, and we need to connect them to the right resources. This position just helps us set up and do that. We had a lot of that was already starting to happen when we had this medical social worker position, but it wasn't necessarily reflected in the job description. So before we get that posted to fill that vacancy, we wanted to make sure it accurately reflected the role. The new position is a grade 7, as was the old position. So we're basically asking to replace a grade 7 with a grade 7.
So no real economic change regarding this, and that this is expected to help our citizens find appropriate resources.
Correct.
Commissioners, any questions? Okay, I think we're good on those 3 resolutions. So Nikki, we can excuse you to go back to your regular duties today.
Thank you.
Thank you very much. Next, we'll move on to our last resolution, numbered 6243. This is to accept a grant for the expansion of Madeline Bertrand County Park. And I believe Mr. Bailey's gracing us with his presence. There's a smiling face, and we got the 2 Brians on the screen. So take it away, gentlemen.
Mr. Chair, while Brian is talking to you, if the committee would like, I can pull up a map which illustrates the property that Brian's going to be talking to you all about. Does that sound like
great?
Okay,
Great.
Brian, go ahead and get started.
Sure.
I'm gonna pull up the map.
Commissioners, this is a Michigan Natural Resources Trust Fund Acquisition Grant. The property is approximately 33 or 34 acres that is to the north of Madeline Bertrand County Park. It connects to the park. If you can see the map that Brian put up, the green lines to the...
We don't see the map, Brian.
It's coming right now.
There you go. Can we see the map?
Yes, now we have it. Thank you.
Okay. The south end of where it says 32.2, that red line, that horizontal line there, that's the 32 acres. It does connect directly to Madeline Bertrand, the northern end of Madeline Bertrand County Park. It really hit well on the scoring. It provides us more trail opportunities. It provides us access to the St. Joseph River and the St. Joseph River Water Trail. Commissioner Majeric, this is almost a direct connect down Ontario Road to the Michigan-Indiana River Valley Trail. That's a very popular regional trail. So it scored very well with the trust fund. And we have a willing seller that took the property off the market, is waiting for the grant process to run its course. So the grant is for $300,000 to be matched with the $110,800 from us, from Berrien County Parks.
Commissioners, questions?
Is this the same property we discussed last year, but now we're just finding funding for it?
If it's regarding Madeline Bertrand, Commissioner, yes. We applied last year. Actually, the grant was due right around April 1st of 2020. And the decision came in December from the trust fund board, and the legislator and the governors finally approved those recommended grants around end of May. And now the contract is coming to us that says we will accept this grant, accept the property, keep it in the public domain forever, and develop it as walking trails, hiking trails, hopefully get access to the St. Joe River for a kayak launch. That's if that brings back any memories of the discussion of the property.
Do we have a kayak launch there now?
We do not.
So this would definitely be in addition to the park.
Yes.
Mr. Chair. So Brian and Jill arranged for me to take a tour with them. We met the property owner at the site. I can tell you it's a beautiful piece of property, but the ease of access to the river is something that I thought was pretty remarkable. It's a nice high bank, but it should be a relatively easy site to turn into a public park. And then the real upside is you can step across essentially just some down trees and you're into the county park system. The proximity of the park and this piece of property are, I mean, literally they're adjacent. So it should be a nice addition to the park system, and long term it should open up even greater access to the water.
How many acres at Madeline Bertrand Park right now?
There's approximately 125 acres of the existing park, and this would add about 33 acres.
And then we're adjacent to the South Bend Park, south of the state line.
We're adjacent to St. Patrick's County Park, and they have acquired over the past several years additional properties, Commissioner. So I'm not real sure how large their park is. I want to say it's probably over 300 acres of St. Patrick's County Park.
Okay, commissioners, questions of the Bryans? No questions, gentlemen?
No, I have no questions.
You don't anticipate? Go ahead, Mike.
I guess the only question is, do we have this locked up? And have we signed any papers yet? Or can it still be sold to someone else?
We don't know. We don't have it locked up. We don't have a purchase agreement with the owner. The owner has been willing to work with us. They know the grant process. But to answer your question, we do not have it locked up. The owner could simply say, thanks for working with us, but we're moving on.
Brian, you don't anticipate another access road into the park based on the acquisition of this property?
I don't think so, Commissioner. The only we may want to have in that right where Brian has the arrow, possibly there is a driveway right there. Right now, it's very rudimentary. It's a 2-track road. Just for possibly either maintenance or emergency access. We'd have to develop a detailed plan. Right now, the plan is just to have walking trails, hiking trails, biking trails, possible access in the northern portion of that property to the river with a kayak launch. If that happened, we would have to likely put in some type of a road to allow kayakers to get down there. So some detailed thought has to go into how we're going to develop this property. It's very open. I mean, there's woods in there. There's a couple of buildings as far as a house that, depending on the condition of the house, would either be torn down or renovated into a park facility of some kind. But
Just to follow up on that, you can see the street, and on this zoom, it's kind of hard to see, but there is a 2-track. I think that if we were to do some type of additional entry point here, we are likely to have some pushback from the adjacent property owner because it's really close. If you're going to come into the site, we should be looking at all options, but this option probably isn't the preferred. And then following up on Brian's comments, there are some structures. This is a barn, and then this is a house. We looked at the house, and I'm not sure there's much benefit there. It doesn't appear to have been used in quite a while.
right.
And then I think these were just like small storage barns.
Yeah, just shelters for, I think they might have had some goats or animals there at one time.
Yeah. But as you look at the home, it's hard to see from this image, but this is the High Bank Bluff. So it gives you an idea of just how close we are to the water.
Good. No change in staffing to accommodate this purchase.
No.
Okay, I think I've ended my questions. Commissioners, any other questions? Okay, we're good. Then we're ready for a resolution to approve all 4 resolutions for presentation to the board at the next, so it'd be next week's meeting.
Mr. Chair, you just need concurrence. You don't need a formal motion.
I think it might be the end of my term before I remember how this works. So.
It's all right. I'll be glad to remind you.
Okay, thank you. You're very kind. Okay, so I believe we have concurrence on all 4 resolutions, gentlemen. So I'm seeing nods.
Yes,
So we're good to go. So based on our agenda, it appears that our next item of business would be public comments. And so Annette, you'll handle that for us.
Mr. Chair.
Go
While
right ahead.
waiting for Annette to load you with the list of public comments. One thing that I just wanted to make PHSC aware of is Shelley continues to progress on the staff evaluation process. So we now have a draft evaluation tool that has been circulated, distributed to department heads for review and feedback. Our intent is to spend the next week to 2 weeks getting feedback from department heads. And once we've got general consensus on the template being acceptable, we'll bring that back to PHSC and give you all a chance to take a look at it. And then the intent is to have PHSC endorse that process so that we can show that there's buy-in from the board level down to the various departments.
Yeah, assuming that goes as you expect, then you would be in a situation where you'll start doing these evaluations for the count based on the calendar year. Then.
Yeah.
We'll leave that up to the department head's discretion. Some departments do it annually based on the employee's date of hire, so they don't have all evaluations at one time of the year. Other departments do them on just a straight calendar year. So I don't think that we're necessarily going to mandate one way or another, as long as an annual evaluation is performed by the supervisor of the employee.
Okay, that makes sense. Annette, are we done with that item then, Brian?
Yes, sir.
Okay, Annette, how many people are watching us this morning?
You're currently at 10. And I've asked a couple of times and it doesn't appear as though you have any public comments.
Okay, then we've concluded all our business. So we'll adjourn the meeting and then I'll see the commissioners and staff for the 10:30 County Board of Commissioners meeting.